So let's talk about a way to breathing that maximizes your intake of oxygen and your exhalation, or your getting rid of CO2. So for this practice, I want you can sit in a chair or you can sit on the floor. What I want you to do is be able to sit upright. So if you're in a chair, sit towards the edge of your chair, and try to feel like your sit bones, the two bony protrusions, which are the bottoms of your femurs, actually, your hip bones, try to settle into them, right? So you can like rock a little bit, scoot. And then in between your sit bones, your pelvic floor, generally try to feel that draw up a little bit. As you do that, you're going to feel a lengthening from the ground up, and you might feel a light contraction at your lower belly. And in yoga, we call this Uddiyana Bandha, but just helps you to sit upright. And in terms of how you're tilting, you want to be a little bit more forward. So if you see the way I'm sitting, I'm not slouching, because it's going to be much harder to breathe deeply. See what happens with my rib cage? So I want you to think of this is called a little bit of an anterior tilt, a little bit of a forward tilt, so that the curve of your lumbar spine is maintained. This is a curve we want. It keeps our spine healthy and from getting undue pressure on the discs, right? So a little bit of a tilt, sit bones settled. Okay, so then this area, your pelvic area, is your support. So it's okay if it's a little bit tight and contracted here. In some practices, we're actually going to do that intentionally. Right now, just don't worry too much about it, but do sit upright. Then become aware of the area of your ribs. Feel your rib cage. See if you can feel the bottoms of your ribs. For me, mine start here. And then I want you to place your hands on the sides of your ribs. So your pinky is at the bottom of your ribs. And as you inhale, see if you can expand. Exhale, let it release. Try to feel your breath down here. Exhale. So we're thinking about lateral movement. There's also going to be some movement back to front. What we don't want is a lot of chest breathing, right? So sometimes when we get stressed, there's this up and down movement, but what we want to think about is more movement down here, right? So down here, less up here. There will be a little bit, of course, right? And you can place one hand on your heart center. Place one between the lower ribs and breathe. Inhale. And exhale. Inhale. And exhale. And you'll feel movement in both areas, but I want you to especially notice it down here. And if you're having difficult to feel any movement here, a nice thing to do is lay on your back and place something heavy like a book on your abdomen. And then feel your belly rise as you inhale and fall as you exhale. And that's especially useful if you're feeling stressed. You can also lay on your belly and try to press your belly into the floor and feel your breath in the back of your body. Inhale. Exhale. Inhale. Exhale. There's something really calming about doing that. So especially if you have trouble sleeping, you're feeling anxious, lay on your belly, forehead in your hands. Think of pressing your lower belly down. And the other thing you can do is feel the breath in the back of your body. That's a kind of a part of our body we neglect sometimes. And you can get a much deeper breath. If you're ever having difficulty breathing, lay on your tummy and try to think of the breath coming into the back of your body. That's used in some cases in patients even who have difficulty breathing in hospitals. With COVID even, they put people prone, so they're laying on their tummy. So those are a few things. But the big thing is to remember to try to breathe laterally, side to side, minimizing up and down. It'll be there, but it's not the primary movement you want to think about. And also feel breath here. Feel it in the back of your body. Try to relax through your shoulders, right? A lot of us unknowingly raise our shoulders when we breathe, so try to feel your shoulders settling onto your back. These are just things you can check in with yourself all the time to think about your breathing, to think about breathing more deeply. And next we're going to do some more specific practices.